Hi Facebook friends, it's a little before noon East Coast time. I'm here in Central Park. I made the 3.7 mile walk from my hotel this morning, a little worn out, just did 2 shifts. Actually I was only supposed to do basically 1 shift because they were delayed in setting things up at Beth Israel. But I'm staying up here. This park is beautiful if you've never been to Central Park. People are walking around, they're keeping their social distancing, they're wearing masks, the whole bit. But I just wanted to show you real quick where I'm sitting. I'm actually at 97th Street and 5th Avenue. And I'm just going to turn the camera here. And you can see in the background here, this is a 70-bed inpatient unit that this organization called Good Samaritan Tents built for the Mount Sinai Hospital, Upper East Side, which is one of the sister hospitals where I'm working. You can see this is right off of 5th Avenue. And so they're expecting, as we're all expecting, a patient overflow. So this is what's going on. It looks like they're still working on it. Yeah, so this is what's going on. It's a quiet day in New York again. You can see there's people walking around trying to get a breath of fresh air as we can. I certainly need it after just working 2 shifts. But I just wanted to kind of give you a little synopsis of what was going on at Beth Israel. Originally, they brought me up to work in a tent that all the Mount Sinai hospitals have put together, including the other hospitals. I'm assuming New York Presbyterian and NYU Langone is probably doing the same thing. But this tent, I think a lot of people are seeing it on TV and they're expecting to come and get tested just to find out if they have it. Well, I know Mount Sinai, we're not doing that. We're actually only testing people that we think are going to be admitted to the hospital. And we actually didn't send a lot of people to the tents yet because we felt they were a little too risky to just talk to them in the tent, give them a quick examination and discharge them. So most of those people came into the ER. And yesterday I had a couple of patients. I originally started in the tent and then they moved me into the main ED because of my background, because they're going to need help with the bottlenecking in the ERs. We basically have 4 pods in there, and one is dedicated to COVID-19. You walk in there and there's a lot of patients that are either already intubated on ventilators or they're pretty toxic looking. And then you've got another section which is like, your kidney stones, your, I cut my finger a week ago kind of thing, which we get at every ER. And then the orange area, which is the overflow, which takes both sides, is where I worked partially yesterday, and then, all yesterday, 12-hour shift. And then the day before. I wasn't expecting to work yesterday, but they asked me to stay, and I was able to get on the system and get acclimated and see some patients. And I'm just telling you guys, and I know you're seeing all these videos on Facebook about being careful and stay at home. I kid you not, this is like a freaking science fiction movie to me. I've been to New York plenty of times and I've never seen anything like this. I mean, this is desolate. I took the subway last night around 10 o'clock, obviously with a mask and gloves, and it's just empty. I mean, the only people that I see commuting are really the healthcare workers, and that's about it. And a couple of my COVID-19 patients yesterday, I mean, if you see the x-rays of these people, and you know, we've had some fatalities, obviously, and I'm just telling you, you really should stay at home. I mean, if you think you're in a small community like Lawrence County, Pennsylvania, and you don't think this is going on, you got another thing coming, because it's coming your way. You know, I just went in the break room yesterday in the ER, and I was talking to some people, like one guy, you know, environmental services, he cleans up the rooms and everything. He said that this has been going on since December. Like, this ain't anything really new. It's been going on since December. And it's patients that we don't know how to treat them, and we're still trying to figure that out. You know, for example, there's a shortage of azithromycin, which in my opinion is a sissy drug, which is now this renewed use for COVID-19, and hydroxychloroquine and Plavix, which are both the malaria drugs, are actually on shortage. And there's people dying every day, I know, at all the Mount Sinai hospitals, a lot. And most of it's really coming right now, believe it or not, from Brooklyn and Queens. That's where they need the help. And they actually called me over the weekend, desperately trying to get people to come into Brooklyn because people were unable to come to work. And they need people. I mean, there's people getting sick. And I'm up here because I'm waiting for a phone call. I'm trying to get a blood test, because I think that I actually had it about 3.5 weeks ago. I had a fever of 102, ranging anywhere from 101 to 102.4, with Tylenol around the clock, Q6, 8 hours, and finally broke after 3 days. But I was ready to go to the ER. But the problem is, at the time, they were only testing people that were traveling or were exposed. So I knew I wasn't going to get tested, and I was like, well, what the heck am I going to go to the ER for? Maybe to get intubated, but I didn't have the shortness of breath. I had chest tightness, but no shortness of breath. But Mount Sinai is doing they're trying to study this convalescent antibody type of therapy for people that recovered from COVID-19. They did this in China, and they actually did this with the Spanish flu in the early 1900s, where they take people that recovered that have IgG, which is you're recovered and you have the antibodies, versus IgM, which is people that have the acute disease, and test to see if you have it and harvest your serum and use that as antibody therapy for these patients, mostly the ones that are critical right now. But my patients yesterday, I did not give hydroxychloroquine right away and azithromycin. Their SATs were really low. And the scary part about this virus, that you don't know who it's going to affect. I mean, if I had it and I'm 56, why am I not intubated on a ventilator and somebody who's 17 is? Doesn't make any sense. So that's why, even though you're in, you know, Lawrence County, Pennsylvania, or, you know, Los Angeles, California, or New York City, or Philadelphia, it doesn't matter. You just don't know how prevalent this disease is. And what's scary about it as a provider, you don't know where the heck it is. Like, I'm on the subway, I'm wearing an N95 mask, I'm wearing gloves. I don't know where it is. I don't know who has it. And then in the ER, I will tell you, in the ER at Beth Israel, and I know the other sites in Manhattan, I don't know about Brooklyn and Queens, because you're seeing on TV about all the shortages of protective equipment. I'm actually in good shape. We're in good shape down at Beth Israel. I have a full gown. They're giving us the N95 mask. We wear it for the day. My shift is typically, 12 hours. And then we have a surgical mask that we wear over top of that to kind of preserve the N95 mask. And then I have a full face shield that goes over. And I have a hairnet thank you, Gay Grossman from OWU, for telling me to wear that. I actually forgot to wear that, and that's kind of a big thing because they're talking about transmissibility possibly to your hair. But I'm just telling you that it's crazy because these patients, they'll come in and they'll talk to you. Not my patients, but per se, but the first day I came, which was on Monday, they had patients that they're talking 1 minute, and then the next hour they're in the ER after their chest x-ray. Their throat's getting really tight, they can't talk, and then they can't breathe. Just like that, like within an hour. It's crazy. If people don't believe that, I mean, I just don't know what to tell you. I mean, after coming up here, reality is set in. This is a science fiction movie. You can't make this stuff up. It's crazy. Now, I will tell you that what we're doing with these tents, what I was telling you earlier, is that we are only talking to patients that we don't think need to be admitted. And we're kind of giving them a quick exam and saying, you know, if your symptoms worsen, return. The long lines of being tested, we're not doing that. I know Mount Sinai, I think all the hospitals that have put that in place, the Mount Sinai system, are not doing that. So if you're seeing a tent outside and expected to be tested, you're probably not going to get it. So that's that. And I'll just tell you, like the chest x-rays of my patients yesterday that I admitted, they are nothing like I've ever seen, like diffuse viral pneumonia. I mean, you wonder how these people are going to survive with these x-rays. It's just crazy. So that's my 2 cents. I'm exhausted because when you wear this equipment, it is so freaking hot. Like, I got this thing over your mouth. You're trying to talk to patients. You're trying to talk to, you know, consults on the phone in the ER. You're trying to talk to your colleagues, and you're like shouting because you can't, you know, you're trying to talk through these masks. And then you've got the elastic around your ears, and it's just tiring after 5 hours of wearing it. So you got to kind of take some frequent breaks, you know, get some water and all that. But everybody's feeling that. But it's everywhere in the community, and actually most of our patients that are coming in, we assume they're COVID-19. And the other question I have, that I actually asked a couple of administrators when I started on Monday, is that what are they going to do with these beds at Javits? Like, how are you going to utilize, as a Mount Sinai system, how are you going to utilize these beds at Javits Center and the ship that I showed you on Monday, which is really cool. I don't know what they're going to do with this, because if they don't want COVID-19 patients, you know, I talked to an ortho physician assistant last night that told me that she had a patient that was in for a knee replacement, and they were there for a while because they had some complications. Well, now they have COVID-19 because they've been in the hospital. So there's nothing much you can do. So how are we going to send those patients over to the non-COVID centers when they probably already have COVID? So none of that really makes sense to me, and I think it's probably something political with the military to protect, you know, it is close quarters, but they're going to have COVID over there, let's face it. So I don't know how these big health systems like New York Presbyterian and NYU Langone and Mount Sinai, how they're going to be able to utilize these extra beds. And I know at Mount Sinai, Beth Israel, where I am, they were looking at building a brand new hospital starting in May. The regular hospital is 20 floors, and almost all of those are closed. But now, because we have so many patients being admitted, they're actually using the construction crews that were going to build the new hospital to retrofit the 20 floors to use those as our own inpatient beds. So this is like, we're making this stuff up as we go along. Like every treatment you think for pneumonia and how to treat these patients. I mean, these patients their saturations, if you're in the healthcare field, your normal oxygen saturation is around 97, 98% on room air. These patients coming in are in the low 80s, high 70s. What's really weird is they're speaking full sentences, which makes no sense from a healthcare perspective. It just makes no sense. But then they're seeing like this swelling in the back of the throat, and that's what's causing these respiratory distresses. Is like really, it's like this upper airway thing. And then the alveoli get affected in the lungs. It's just a very detailed pathophysiology of how this disease affects people differently. You know, like I said, why, if I had it, why did I recover as a 56-year-old versus a 17-year-old lacrosse player for Bates who is on a ventilator? So it just doesn't make any sense. Now, the other question people may be asking is, why do you need 20 to 30,000 ventilators? Well, I'll tell you, because these people decompensate. There's a high volume of people in New York. I mean, this is the largest city. So you have to be prepared for that. And they're not hoarding the vents. It's just that the prevalence of this disease has been here earlier than the other cities in the country. And I'm sure what you could do is you could take all those extra vents and ship them to wherever you need them, the hot spots, Detroit, Louisiana, Los Angeles, all those places. So that's my 2 cents on that. But I also wanted to thank you guys, and I'm sorry I'm going to get teary-eyed. It's goofy. I get like this. But I really appreciate all the messages you're sending. It's part of my job, you know, and I took this as like an assignment because I had some extra shifts. But I really appreciate all the messages. They're just really kind. And some people are sending messages asking like what they can do. And I'll tell you what you could do. I hate to tell you this, but like my homemade masks that I posted, I don't want to wear them to see patients. But I am wearing it like on my way to work. And Dan O'Neill, my high school classmate, sent me a whole box of P95 and N95 masks. So I've got a nice supply. But I would not wear that mask to see patients. And I haven't seen that at Beth Israel. I haven't seen that problem, so I think that's okay. But you know what could really help us? And you know, the people where I live, like maybe Mainline Health or University of Pennsylvania, we could use food, actually, believe it or not. Food at where we work. And I don't know how that would work, but I know here at Beth Israel, restaurants locally are donating sandwiches, they're donating pizza, drinks, you know, stuff like that, because there's not a lot of stuff open. We don't have a lot of time to run and get stuff or get takeout. We can't degown completely because it's wasting equipment. But that's something we could do or you can do if you want, is to donate food. Or I had the best chocolate chip cookie. I mean, I've been doing so well on my diet the last 3 months, but I had to cheat. I had a slice of New York pizza and a couple little chocolate chip cookies, and boy, were they good. And they just hit the spot, and then you're there, you know, you take a 10-minute break, and then you're back out and into the fire. So that would be a big help. And I can't think of anything else to say, but just what everybody's saying, stay home, because and I'll be back next week. I'm working 3 shifts next week. This weekend I'll be up in New Hampshire, which is, I'm sure, will be a totally different environment in the ER. But next week I'll be back here, and they're saying the peak is probably going to hit next week. I would say the last 2 days that I've been working, it's just been a lot of scrambling and administration really trying to figure out operationally how we're going to run this thing. But people are pouring in, and they're very sick. That's all I can tell you. They're very sick. And I recovered, but I may not have recovered, and I don't even know how I got it. The only thing I could think of was maybe Orange Theory, but that's about it. So I'm just telling you, this is painful to stay away, but you got to stay away for everybody else, especially like my parents who are 88 and 89 years old. That's not fair to them for somebody to say, well, I want to come and clean your house because I can't make any money. give me a freaking break. You're going to spread it from one house to the other. And it's just a very selfish thought. And I just hope people aren't feeling that way, because this is serious. And I know you're not seeing it, but you're seeing the crap on TV. And everything you're seeing on TV is real. I'm not kidding you. It is real. So signing off for now. Hope you have a good afternoon. It's a little chilly outside up here. I hope by next week it warms up a little bit. But I'll just finish with one more view of the tents out here and the beautiful scenery. Here's Mount Sinai Hospital, Upper East Side, and just give you a little bit of the scenery here. So, in that sense, sayonara. And hopefully I'll talk to you guys next week. If anybody's in any of the other ERs, let me know how it's going. I'm just curious to see what everybody else is experiencing. If you are working in New York City at another health system, I'd like to hear what you have to say. But like I said, I'm gonna repeat it again. The people that I see coming in are really sick, and they look fine one minute, and the next minute they can't breathe. And you don't know, we just don't know, like from an immunologic standpoint, how this is affecting people. And that's what's scary about this whole disease, because we don't have this down clinically yet. That's the problem, we just don't have it down. So the less people get infected, the more it gives us a chance to spend time on trying to figure this out. So see you later. Have a good afternoon. And I'll talk to you next week. Take care.